Hi, welcome. And I'm here to talk to you today about congestive heart failure. I know it sounds like a terminal illness, it sounds like you're dying, but I'm here to tell you today we have patients who live for a long time with a good quality of life. So what is congestive heart failure? Some people describe it as, if you think of your body as the car and your heart is the engine, well, it's when the engine is weak. And as a result of that, fluid backs up in the lungs and you feel like you're drowning or suffocating. It's our job to determine what caused that engine to fail. We get asked a lot is how to deal with the craving to want to eat more salt, because we limit your salt intake to 2,000 milligrams a day. Again, that's barely a teaspoon. Well, we ask you to use a salt substitute, or actually use herbs and spices. If not, just use garlic or thyme or red pepper or black pepper, any one of these herbs or spices to take the place of your craving for salt. I promise you, if you give it 4 weeks, you will not miss salt at all. In fact, the next time you go out to someone's house or out to a restaurant, you almost want to spit the food out because you will notice and taste every morsel of that sodium. Lastly, how to deal with your craving to want to drink. We asked you to limit it to 64 ounces a day. We recommend that you chew gum or candy, sugarless if you're diabetic. It's really going to get that saliva going, help you deal with that craving. Some of our patients recommend to freeze grapes. That's actually great. If you ever tried it, it's pretty good and it's going to really help deal with your craving to want to drink. So freeze whatever fruit you like. Grapes work really well. Or freeze that water bottle that you're drinking, that 16 ounce or 20 ounce bottle. Instead of just drinking it straight, freeze it, and then you can sip on it for several hours. So those are just some of the tricks we want you to do to deal with those cravings. In addition to those lifestyle changes and medications, it's our job to determine what caused that engine to fail or to weaken. And it can be a number of things. Some of the most common things is bad plumbing, of the arteries clogged up. How we fix that is we do a procedure called heart catheterization, where we look and see if you have blockages. We can remedy that by sometimes surgery, bypass surgery. That's when the surgeons will have to do bypass. Or we can open up the artery with a balloon and leave a device they'll call a stent. We'll keep that artery propped open. It acts as a scaffold. In addition to bad plumbing, it can be a leaky valve or a tight valve where the opening is very small, and so not enough blood can go through that opening, and so it's very easy for fluid to back up in the lungs and make you feel like you're drowning. Uncontrolled blood pressure, alcohol, sleep apnea. We're finding more and more people actually have sleep apnea, including myself. Okay, so what is sleep apnea? Well, that's, for example, if you have obstructive sleep apnea and you have a big tongue, for example, when you lay down, that tongue blocks your breathing tube. And when it blocks your breathing tube, not enough of the normal oxygen that enters actually goes down the lungs, and your lungs collapse and you stop breathing. Okay? So fortunately, God made it so for the brain to wake us up when it senses we're not breathing. And so you wake up almost like in a panic. And as a result of that, you don't get your good deep REM sleep because you don't sleep well at night. When you don't get your deep REM sleep, you're extremely fatigued for the rest of the day. And you may start have problems with your memory. You may wake up with a headache. You may notice uncontrolled blood pressure. You may notice the rapid heartbeat. Those are some of the signs and symptoms related to untreated sleep apnea and eventually congestive heart failure. Well, we try to treat that. A lot of patients wear a mask called a CPAP device. And what it does is it allows the normal oxygen that enters and it creates a vacuum around your mouth and nose that will force literally the oxygen down the lungs under pressure. Keeps those lungs open, so you don't stop breathing, you don't wake up in the middle of the night, you get a good deep sleep. And we can prevent those unfortunate side effects or complications that we spoke of, and more specifically, congestive heart failure. If you're getting short of breath, especially when you lay down and you have to sit up to breathe, that's most likely congestive heart failure. Or you get on that scale the next morning after you've gone to the bathroom and you've gained 3 pounds of unexplained weight gain. Generally, that means the fluid's back because you may have had too much salt or water. So what we instruct you to do is go ahead and double up on those water pills. Instead of taking 1 in the morning or 1 in the evening, we don't mean that. You double up by taking 2 at the same time. And if that doesn't work, then that's when we want you to call us. Obviously, if you're very short of breath, even sitting up, we want you to call 911. So when you double up, we want you to go ahead and do that for 2 to 3 days until you lose those 3 pounds of extra fluid weight. And again, if it doesn't work, please give us a call, because we may instruct you to triple up or quadruple up, but then we'll have to see you in the office because you can lose too much electrolytes. For example, potassium, and you start getting that cramping, and that's a painful feeling. So we also don't want you to wait till you gain 5 to 10 pounds, because again, these water pills may not work when you double up. And again, we may have to triple up or quadruple up. Okay, so now that's how you recognize when you have too much fluid. We also want you to recognize when maybe you're taking too much water pills. So most people, if you drink 2 liters or 64 ounces a day and you're taking your water pill, that kind of keeps your fluid status even. You don't have too much and you don't have too little. But you can have too little if you're doing what we ask, but in addition to that, you have diarrhea for some reason, or you're working out in that sun and you're a sweater. So that means you may be putting out more than you're taking in, and you will experience lightheadedness or dizziness, okay? Feeling like you want to pass out, okay? Or you may start to see that your urine, instead of being clear yellow, your urine looks pretty dark. If that's the case, that may be a sign that you're not drinking enough water. So we asked you to go ahead and drink an additional 8 ounces of water that day, or maybe you decide to hold off on your fluid pill that day or the following day, okay? So, but if you have any questions about whether or not if you have too much fluid or perhaps dehydrated, just give us a call. We'll help to help you figure that out as well. Otherwise, thank you for your attention. Please don't hesitate to call us if you have any questions about anything we talked about today. Thank you.